last week answers, week 4, as you remember, the symptom was fever. Yet again, disclaimer here, we are nurses, we don't technically diagnose, we are using this as an educational to enhance our critical thinking skills. All right, patient number 1, the answer is MH, and what got us there was obviously, you know, this patient is adopted, we don't know their medical history, but the clues here would be the rigid extremities, the shivering, the tachycardia, and then the temp rising to 103. So obviously the treatment would be you're going to be wanting to hit the code button or getting anesthesia back to the bedside stat if they're not present. And then the MH cart, as you know, comes from the inner core of the OR. Patient number 2, urosepsis versus sepsis here. What led us to that is obviously they have gone to surgery, they've had a stone manipulation with a stent placement, so just getting that guide wire up there and with that stent placement has probably stirred up some of that infection. They've had a low-grade fever in the ER, which now they do have a temp here in PACU at that 102.6 and or pre-op. Some treatment options that you would maybe consider would be maybe treating that fever and or antibiotics, and then if you need further resources, calling your RRT. Okay, patient number 3, we said pneumonia here for that diagnosis. What led us to that is the patient was a trauma, having those rib fractures. They also have a pelvic fracture, probably haven't been up out of bed, probably not taking those deep breaths, expanding the lungs. Now on admit to the PACU and or pre-op here, we've noticed that the lungs are coarse in the upper lobes, and then worse on the left and diminished, and then the SATs being 90% on 4 liters. We would, as far as treatment, would probably expect some blood draws, maybe a chest x-ray, and then an antibiotic for treatment of pneumonia if that is the diagnosis via the chest x-ray.